Hello everyone, welcome to LUMP's special lecture series featuring earseed acupressure and auricular therapy, day 3 of 4. Studying the photos along with the information in the presentation assists the practitioner at becoming visually adept at recognizing and diagnosing these pathologies. Respiratory disorders. Respiratory disorders in the ear show up in the form of two pathologies, depressions or red marks. A depression is one that is deeper than the size of normal point depth. Some depressions are very deep and some appear like several enlarged pores. Depressions indicate deficiency of point on which it is found. Depressions on lung points indicate lung qi deficiency, like asthma, shortness of breath, fatigue, allergies, tightness in chest, walking pneumonia. Small pore-like depressions on the upper and lower lung points, characterized by shortness of breath, tightness in the chest, accompanying walking pneumonia. Small pore-like depressions on the upper and lower lung points and a deep heart point. Manifestations: fatigue, shortness of breath. Small pore-like depressions on the upper and lower lung points and heart point. Shortness of breath in the morning. Heat shows up as redness on the body. Heat on allergy point indicates allergies that have heat characteristics like nasal congestion, yellow mucus, low-grade fever, slight sore throat, red tongue, thin yellow coat, slightly fast superficial pulse. Allergies may be respiratory allergies or skin allergies, rashes or pimples, since lungs dominate the skin. Redness in scapha on allergy point. We have allergies and dermatitis. Red appearing on this point, although not visible in this black and white photo, has clinical differentiation of allergies. Cardiovascular problems. Cardiovascular problems show up in the ear in several places. Depressions and grooves indicate deficiency. Depressions in heart area indicate heart qi deficiency, manifested as high blood pressure, family history of heart disease, shortness of breath, palpitations, low blood pressure, numbness and tingling in the arms and hands. Deep, depressed heart point, palpitations, tendency to worry, tingling feeling in the hands at night, tightness in the mid-back and chest, low blood pressure, heart murmur, received 3 blood transfusions at birth due to RH incompatibility. Grooves. The low blood pressure groove suggests heart pathology as well, originates from the low blood pressure point. The low blood pressure groove does not travel on an angle like Frank's sign, but rather folds vertically downward, resembling a collapsed fold in the skin. So we have here low blood pressure groove, which means that the patient has low blood pressure. Frank's sign is a diagonal crease on the earlobe that originates in lower blood pressure area and extends downward on the diagonal line laterally across the lobe. The longer the crease and deeper the crease, the more serious and long-term the problem is. Compare the difference between the low blood pressure groove and Frank's sign. This is Frank's sign. Redness. Red indicates heat. Red heart point indicates heat in the heart. So we will have restlessness and insomnia. Unfortunately, color pathology cannot be depicted in the black and white photos, but the suppuration can be seen. Heat may cause rashes and oozing of fluids at heart point or points related to the heart, most notably Shenmen. So here you could see suppuration at Shenmen. Anxiety, skin rashes, nausea. Hepatobiliary, gastrointestinal problems, stomach, spleen, liver, gallbladder, small intestine. Phlegm ridge indicates dampness or phlegm being retained in the stomach, either due to weak stomach qi failing to rotten and ripen the food, or phlegm created through consumption of proper yin of stomach by heat or liver qi stagnation. Phlegm in the stomach can cause nausea, stomach pain, food stagnation symptoms, abdominal distension. So here is an example of phlegm ridge and duodenal ulcer manifested as knotted abdominal pain at the center of the stomach, which is at the CV12. Here you have a long phlegm ridge extending to the spleen area, manifested as stomach pain, liver pain, fatigue, pallor, loose stools, abdominal distension and gas, signs and symptoms of spleen qi deficiency and yang deficiency. Puffiness. The spleen area typically appears as puffy, a clear example of spleen qi deficiency and yang deficiency, where spleen fails to transform and transport the digestate, which results in damp retention or puffiness. So here you could see puffy stomach and spleen points. There will be nausea caused by damp retention in the spleen and stomach. Puffy spleen point and abdominal distension is a major complaint, which is a cardinal symptom of spleen qi deficiency and yang deficiency. Heat in the stomach and liver areas is common clinical finding. Heat shows up as redness, while ulcers with heat manifestations show up as red marks. The following slide illustrates a duodenal ulcer. Note dark spots at the end of stomach point and the beginning of duodenum point. This patient has a duodenal ulcer, experiences what she describes as knotted abdominal pain, reports a high level of stress, a leading cause of ulcers. Spleen tends toward deficiency and collapse of yang. This syndrome shows up as collapsed spleen border. Stagnation is typified by its characteristic purple color. Purple in the liver area indicates liver pain, and on the pancreas suggests pancreas disorders such as hypoglycemia. So here you could see the collapsed spleen border and the large bump in the upper thoracic or lower cervical areas. Typically spleen qi deficiency and yang deficiency. Miscellaneous organ pathologies appear in the ear. Brown dot on mammary points would indicate bold blood stagnation and fibrocystic breasts. Puffy forehead point indicates sinus infection. Constipation ridge manifests long-term constipation. Eye groove or myopia groove forms a crease or fold originating from I1 point and travels downward. It consistently indicates problems with vision, especially nearsightedness. Tinnitus also appear in the ear as a groove called tinnitus groove. So here is an example of myopia groove. Patient is nearsighted with floaters, decreased nighttime vision, frequent red eyes, skin patches around the eyes. Tinnitus groove, ringing in the ears, vision problems. If not caused by direct injury, scars in the ear represent removal of an organ or body part. Marks can be viewed similarly to scars and indicate problems on the point where they are found. Here is an example of a mark on the throat point. Patient had tonsillectomy. We have also a scar on the throat point, history of tonsillectomy. Capillaries indicate circulation problems, trauma, surgeries. These are commonly seen in the lower extremities, hip, knees, ankles, which tend toward poor circulation. Capillaries in the ankle area means weak ankles. Birthmarks are viewed as blood stagnation, which may affect the areas on which they are found. Birthmark on the shoulder area represents congenital shoulder weakness. Structurally, bumps, lumps, ridges, arthritic bone growths are very similar, as are their diagnostic meanings. These structures can be viewed as excesses. Dampness appears as soft bump and phlegm as hard. They're opposite of grooves or depressions that are caused by deficiencies. Here we have a white bump on the neck area, cervical disease. Ridge in the neck area manifested as neck pain. Groove at cervical point, neck and shoulder tension. Two examples of a high pronounced antitragus, smart crest, which indicates high intelligence. Deviation of antihelix screws and a ridge in Simba concha are also congenital. So this is a smart crest, which indicates high intelligence. See if you have it. Another example of a smart crest. A pathological lumpy ear is a good ear to benefit from massage. Although some practitioners of auricular acupuncture maintain that there is no need for either diagnosis or prescription construction, but only adherence to set formulae for specific conditions, this is generally not the Oriental medical viewpoint. As in body acupuncture, clinical experience and/or research have revealed ear point combinations for clinical conditions. Before selecting points or beginning treatment, establish a working diagnosis of the patient's illness in Oriental medical terms. A treatment plan can then be established. For instance, if the patient has a headache at the vertex, and you have correctly differentiated this type of headache as liver yang rising, the treatment plan then is to subdue the liver yang. Now, select points for their best therapeutic value. Energetics of ear points can be chosen from understanding of Oriental medical theory. In the case concerning headache at the vertex, select ear apex point, which reduces liver yang, and liver point to adjust the liver. Inclusion of ear points that addresses etiological factors assists in a more long-lasting resolution of the problem. Consider the application of this criterion to the liver yang rising headache. First, we must determine etiology of the liver yang rising. Is the liver yang rising due to liver yin deficiency, liver blood deficiency, kidney yin deficiency, or earth counteracting on wood? Points are selected according to the specific etiology of the patient's problem. For instance, add spleen and stomach points if headache is due to earth counteracting on wood, kidney point if headache is due to kidney yin deficiency, and so forth. When so many points are used, we cannot determine whether they have a synergistic or antagonistic effect on each other, nor is it clear which point is the main one. Therefore, less than 4 points should be used in each treatment. Use of points on one side is sufficient to treat the disease. For certain diseases, for example, gastrospasm, sprains, pain in the fingers, stimulation of a single auricular point is enough to obtain a good result. The number of points used does not determine outcome of the treatment. The principle of selecting a few good points guarantees a good result. Avoid a symptomatic approach and instead correctly differentiate the syndrome and address etiological factors. There are times when the one well-chosen point is all that is needed, particularly in pain or disorders with musculoskeletal involvement. A typical prescription is about 7 to 8 points. You should be able to define where all the points are. This verbal ability will reinforce your adeptness at location. Practice to become proficient at point location by using the ear for treatment. The map presented in our notes is traditional, time-tested, and easy to learn and to remember and master. Other modalities are highly correlated with a treatment plan, clinical research, a diagnosis, a clinical disorder, or the nature or physiology of the point. If the point is more of an area, such as the sacral vertebrae or the constipation area, an intradermal can be more effective because an intradermal stimulates the entire area versus a specific point. If heat or fire are present, bleeding is preferred modality to drain the heat or fire. Most common angle of insertion is perpendicular. A few number of points are needled at an oblique angle. The angle is dictated by anatomical location of the point, so think about physical access when needling the point. For instance, brain point, located on the posterior aspect of antitragus, cannot be needled perpendicularly. One needs to needle obliquely behind the antitragus toward the point. In the event that the desired results are not being met, you can change the angle of insertion to increase the effectiveness of the point. These angles of insertion have not been standardized by any practitioner because there are so many degrees at which the point could potentially be needled, and again, most points are needled perpendicularly. The chi sensation obtained in the ear, especially of heat. The degree of ear treatment effectiveness has been correlated with the chi sensation obtained in the ear. Clinically, the sensation of heat perceived by the patient has been shown to be the most effective variable for successful ear treatment. Try to obtain this through accurate point location, best insertion angle, needle technique, patient perception, and feedback. With our expertise, we can help to redirect the chi according to the natural laws of life. However, healing does not always occur, and we must accept that fact. The patient's life force may be beyond our ability to reach with ear modalities. Some diseases will be easy to treat, some impossible, and with others the results might be limited. To enhance compliance, inform your patients of the treatment plan and prognosis and provide them with written instructions of all directives. The patient may not keep appointments or change certain lifestyle factors. Personal resources like money, transportation, social support for treatment are oftentimes limited, as is the ability to follow self-treatment instructions. Point selection in both body acupuncture and auricular acupuncture is an art because it is based upon the uniqueness of each patient. Therefore, the practitioner must be able to look at the deeper web of physiological and energetic symptoms and decipher them. Unless the patient has bronchitis, bronchial asthma, or congestive heart failure, excess phlegm in the chest which can interfere with respiration, begin treatment with Shenmen. Shenmen largely works by increasing dampness in the body, thus its contraindications. Shenmen quiets the heart, calms the spirit, and puts the patient into a state of receptivity for treatment. Shenmen anchors the spirit before the qi is tonified or dispersed. Three treasures paradigm maintains that of the three treasures, qi, shen, jing, the shen must be treated first before qi is adjusted. Shenmen is useful in pain control, in reducing anxiety and restlessness, and in controlling the blood. Start with one major point to treat the disorder. For instance, if the patient has a respiratory problem, Shenmen may or may not be indicated. If phlegm is present, Shenmen is prohibited. Otherwise, Shenmen could be an excellent point to reduce the anxiety that often accompanies respiratory problems. Because the brain controls everything, it is rare not to use the brain point in every ear prescription. Brain or brainstem points can assist in regulating respiration. Choose a lung point as pivotal to the prescription because the lungs are the anatomical and physiological organs responsible for respiration. Then, round out the balance of the prescription. Kidney point can be added to the prescription to facilitate deep breathing and enhance ability of the lungs to descend and disperse the qi so that the kidney will grasp the qi. Sympathetic point aids in increasing vasodilation if air pathways are constricted, balances autonomic nervous system, reduces any pain associated with the problem such as tightness in the chest. To reinforce treatment, Ding Chuan and stop wheezing points work well together if there is a pronounced problem with inhalation. Otherwise, one or the other can be selected. Diaphragm point is used to open the chest, make the auricle more sensitive to treatment, spread liver qi, and balance the three jiaos which are in disharmony. Chest, inner nose, and or trachea as local points can be added to treat localized symptoms and reinforce the treatment based upon the specific locales of the respiratory problem. Consider interaction between the ear points and how the formula works as a whole to treat the condition. For instance, the lung point works harmoniously with the kidney point because of their Zhangfu and five-element interrelationships. In contrast to synergistic relationships, some points work antagonistically against each other. For instance, the anti-fatigue point or the mouth point can interfere with the insomnia point because of their opposite actions. A patient has insomnia and therefore is tired during the day and may desire more energy. As the practitioner, you chose insomnia point to promote sleep and mouth point for its anti-fatigue effects. These points may counteract or even nullify the action of each other. The most important point to use here is the insomnia point. When the patient gets enough sleep, he will not be as tired during the day. But if you use both points, be aware that if you have the person rub the mouth point at night, the resulting stimulation may keep him awake. Instead, the insomnia point should be rubbed gently before going to bed, but not too vigorously, or it may keep the patient awake. Prescribe fewer ear points and instead treat the root of the patient's variety of insomnia. If the basis of the disorder is insomnia due to heart yin deficiency, then choose the heart point. If root of the insomnia is due to fullness in the stomach, then choose the stomach point and recommend eating earlier in the evening. This holds true for treating the etiology of their fatigue as well, which could have numerous origins. Choose powerful points with multiple functions: brain, sympathetic, adrenal, vagus, diaphragm, occiput, brainstem. Add brain to every formula because brain regulates the entire body, brain point tends to be tender on palpation because it controls everything. Sympathetic is central when patient is experiencing pain or imbalance in autonomic nervous system. Diaphragm point or point zero is important for harmonizing ear acupuncture formula and connecting all three jaws. Add points that treat root of disorder and augment prescription with points that treat symptoms originating from the root. Select points that get at the root of the problem. Do not just think symptomatically. If skin problem is due to hypersensitivity to an allergen, add liver point to promote free flowingness of qi. If skin disorder is due to an autoimmune problem, choose kidney, which is foundation of immunity. Add other points based upon signs and symptoms. For instance, if skin problem is characterized by itchiness, pain, inflammation, add sympathetic point for its ability to treat these characteristics. Also, remember, the lung controls the skin. Select points based upon location of organ, body part, or disease to direct the treatment. Points are selected based upon location of organ, body part, or disease that is affected. Use these points as core points that act as vectors to reinforce a prescription. For example, if there is acne on forehead, select forehead point. If there is eczema on the cheek, select the cheek point. Other points would be chosen depending upon precise location of the problem. If the problem relates to a spinal segment such as back pain in lumbar area, lumbar vertebrae are some of the first points to select. Do not use points redundantly, but use points to reinforce when needed. There are times when reinforcement is a good and necessary option. For instance, if the person has severe intestinal cramps, you could treat large intestine through the large intestine point, and the abdomen point can be chosen for reinforcement. However, if you are treating diffuse abdominal pains, the abdomen point may be sufficient. Use clinically effective points, which are points with known proven effectiveness. Clinically effective points, which are points derived from research, have known proven effectiveness in the treatment of various disorders. They are important points to consider in an ear acupuncture prescription. Lumbago point for low back pain. Lung point for smoking addictions, weight loss, ulcers. Shenmen for addictions, weight loss, anxiety. For musculoskeletal problems, apply auriculotherapy and then have the patient mobilize the affected area. This movement, along with the ear treatment, sends a message to the affected body part. This movement is key to the success of the treatment. Use auricular acupuncture before or after massage and chiropractic adjustments to help hold the treatment and reduce muscular spasm. Thank you very much for your attention.